Depression. In this lesson, you will outline the definition, causes, and management of depression.
Introduction. We face many problems during the course of our lives. As toddlers, not getting a favorite toy upsets us. During our teens, having friends and succeeding at school take priority. If we have trouble making friends or don't do well on tests, it upsets us. A short bout of this feeling is natural, and usually we move through it fairly quickly. In some cases, it can persist and affect how we relate to ourselves, others, and our responsibilities. This prolonged and overall feeling of sadness, along with a loss of interest in usual activities, is called depression. It is the most common of the mental illnesses and needs timely intervention and professional attention, just as you would if you had a bad cold for an overly long time. There are risks associated with untreated depression, which can lead to the use and abuse of drugs and alcohol, thoughts of suicide, and changes in behavior. However, seeking support early can help reduce these risks. Let's learn some more about depression. Causes, effects, and signs of depression. When Dana and her family suddenly moved to another state, it came as a shock to all her friends, including Samantha. While the other friends began to recover from this shock within a few weeks, Samantha still finds it impossible to accept Dana's absence even after a few months. She is always teary-eyed, has stopped going out with friends, and has become listless and morose. Her grades have slipped, and she has lost a lot of weight. Why is Samantha taking so long to recover from this loss? Samantha is depressed. Common sadness and depression seem similar, but actually are very different. When the feeling of sadness lingers on and starts affecting our daily life, it turns into depression. We often mistake depression for common sadness or moodiness. While common sadness and mood swings are typical of adolescence, depression is a mental illness that needs to be treated. Depression is not just a state of mind. It originates in a chemical imbalance in the brain. Although we can't pinpoint the exact reason why some people are more prone to depression than others, we can identify some triggers. Some of these triggers include a family history of depression, a traumatic incident such as death, separation, or loss, a move to a new place, or an accident, pressures at school or work, or worry about the future, people suffering from low self-esteem or who have a negative outlook, people suffering from critical medical conditions, situations of abuse or bullying.
Depression, like other illnesses, has different varieties, with different causes and levels of severity. While milder types of depression can go away with time and care, all types of depression should include medical support. Reactive depression is a common form of depression that happens in reaction to an event outside of yourself or external that causes trauma. While we often experience sadness around the loss of a loved one or trouble at school, reactive depression lasts longer than the average feeling of sadness. Major or clinical depression is a medical condition that is more severe than reactive depression and lasts much longer. It could be genetic in nature or may occur as a result of a chemical imbalance in the brain.
Depression is a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. People struggling with depression may not look sad, but here are some symptoms to look for. Trouble concentrating, withdrawn from social activities, changes in grades, fatigue, anger or irritability, agitation or anxiety, changes in food or sleep habits, loss of interest in activities they once loved. A person may experience feelings of guilt, worthlessness, or hopelessness, as well as thoughts of suicide, which are also warning signs of depression. It's important that we look out for symptoms of depression in people we care for and in ourselves.
Drag the tiles to the correct box to complete the pairs. Match each type of depression with its characteristic. Give you a moment to briefly do that. Severe and ongoing, needing medical attention. A traumatic reaction to an external event. I remember they talked about reactive depression first, and it was a traumatic reaction to an external event, and major depression was more severe and needs medical attention, and it may be ongoing. Correct. Major depression is more severe than reactive depression and lasts much longer. Reactive depression happens in reaction to an external event causing trauma.
Ways to manage depression. There's no way around the fact that life is full of emotional ups and downs. Emotional turmoil can come from events as different as a significant loss of a loved one or pet, for example, or a sudden change in your life, such as moving to a new, unfamiliar place. Or it can arise from school or work difficulties, disappointments or failures of many kinds, conflict with a friend, or a prolonged illness or disability. Becoming self-aware is critical to managing depression. We can increase self-awareness by paying attention to the feelings associated with those ups and downs. Some of the ways we can explore these feelings are by talking with trusted friends, talking with a family member or other trusted adult, writing in a private journal, engaging in creative activities that express our mood, checking in with ourselves. The desire to belong is natural. We all want to feel loved and connected. Teenagers particularly want to be connected to their peers. Depression can be more likely to occur when we feel disconnected, put down, isolated, or like we don't fit in. Emotional pain, like depression, hurts just like physical pain, such as a broken arm. In fact, it triggers the same area in our brain where physical pain occurs. To avoid the pain of depression, it is common to seek relief. The best way to seek relief, just like with a broken arm, is through medical help. But sometimes we seek relief in other ways. Some of the less helpful ways people try to ease their pain include drugs and alcohol, self-harm, risky or violent behavior. Some people can also suffer from suicidal thoughts. These ways may help dull the pain, but they do not really help heal. Again, it's important to recognize depression before it escalates. Then find ways to express your feelings to yourself or others. Get involved in activities that help you feel good, and seek support from people trained to help. There are some positive things you can do to help your mental wellness. These things can change the chemistry of the brain to help support a more positive outlook. While they may not fully treat depression, they can go a long way in helping manage it. Some of these positive self-care habits include exercise. Exercise releases health endorphins, or good brain chemicals. Eating well. Sugars and fats can deplete us and cause fatigue. Reaching out. Connecting with people we care about can remind us we are not alone. Naming our emotions. Identifying the words for how we are feeling underneath helps give back a sense of control over our emotions. Helping others. Helping others take us out of our own head. Identifying a goal. Working towards something small but meaningful increases a sense of purpose. One of the things that can impact the likelihood of depression includes negative self-talk. Have you ever given yourself the message, "I never do anything right," or "I'm worthless"? Negative self-talk, which we have all done, can feel really bad. People struggling with depression often have a lot of negative self-talk. Changing it takes practice, but it does help. Pay attention to the messages you give yourself, which can come from things others have told you or from your own false self-perception. Here are some things you can do when you notice negative messages. Remind yourself that we all make mistakes. It is normal. Tell someone your thoughts and ask for their perspective. Change the message from, "I can't do this," to, "I just need more practice." Pretend you heard a friend give themselves the same message. What would you say to them? Focus on the facts, not what you think is going on. What you say, "They are not calling back because they hate me." What you know, "They aren't calling back right now. Maybe something is stopping them." Pay attention to the messages your friends and family give themselves as well. You can help by using some of the suggestions above.